Hello everyone. I'm Dr. Ranjula. I currently work in a COVID-19 treatment ward in Sri Lanka. I have nearly like 10 months of working experience in managing these COVID-19 patients. Our country has faced four waves of COVID-19 waves, and currently we are being hit by the fourth wave, and we believe it is the notorious Delta variant. So, as a doctor involved in the management of this COVID 19 patient, I must say the battle is getting worse day by day. We see our own people suffer, and we kind of losing them. And some of them belong to the working force of Sri Lanka. Nevertheless, each and every person we are losing is someone who is important to their loved ones. They may be the sole breadwinners of their family. So, unfortunately, day by day, we see the real tragedy here in our old soil. So, when we think of finding way to mitigate this damage that we face, it is obvious that the treatment units all over the country should be sufficient enough with resources and equipments, so we can face the battle against COVID-19 in very efficient manner. The main purpose is to sustain the life of our own people until we provide the optimum and necessary care and make them ease. So, upon the request of our good friend Mr. Tusita, I thought of educate you regarding the necessary equipments of COVID-19 treatment units. The idea behind is to enlighten our own expatriates regarding what we need most at this crucial moment, and getting their help to get these resources and distributes these throughout the country as soon as possible. So, as a continued part of the same project, the same purpose, we are making a national list which includes all the necessary equipments in urgent basis, which will be distributed during soon. So, getting into my presentation, I would like to show you the status of one of our ward. So this is in one particular day. This is just the glimpse of just two COVID-19 treatment wards of our unit. So what I want to understand here is we need oxygen and various devices used to deliver oxygen. So these devices are used depending on the clinical requirements of our patients. So this particular day we had like 53 patients who are oxygen dependent, and I have shown you various devices that we were using. So in this particular day, just focus on the highlighted text. I have shown you at the bottom we have used like 1.1 million liters of oxygen. So this is just a picture of two words in a single hospital. Hope you would understand the gravity of the clinical status, the gravity of the real story happening here in our motherland. Right. So actually we are approaching a major crisis. So we need to prepare for the crisis. So this is a battle against COVID-19, and without preparing we can't fight with the COVID-19, and the aftermath is we would be losing a lot of our loved ones, and this may be ourselves or maybe someone else, mother, father, husband, wife, whoever. So talking about the real situation, let's go back to the presentation proper. So here I have shown you when it comes to the survival of a COVID-19 patient, I would like to show you some important facts, right? So the first one is we need oxygen, obviously, and the second one is we need certain devices which can deliver oxygen to the patient. So having oxygen won't be enough. We need oxygen devices, then only we can deliver this oxygen to these patients. So then if we can provide the oxygen and the oxygen devices, we can sustain the life of our patients. Then we have time to give the necessary drugs, and in the treatment course we can use some other devices. So all these four will be included in the treatment of COVID-19 patients. But I must say there is another aspect of COVID-19 patient, and that is, if you take the whole COVID-19 population, some of them will be ended up in permanent lung damage. So they will face certain problems in future because their lungs have already been damaged. So in order to optimize the remaining lungs, we need certain other aspect of delivering care that belong to the rehabilitation. So the treatment and rehabilitation are both important in the total care of COVID-19 patients, and both these treatment and the rehabilitation goes in parallel manner. So such as examples, I can say there are certain patients while being treated at the ward, we start the rehabilitation process at then and there. So all these two pathways go hand in hand, and we need certain aspects, we need certain requirements for the treatment as well as rehabilitation. Right. So discussing more regarding oxygen, in most of our tertiary care hospitals, we have certain plants like it's kind of oxygen store, and these stores may be considered of two aspects. A certain plant may contain liquid oxygen and other plant may contain oxygen cylinder bank. And liquid oxygen plant, obviously the oxygen will be stored as liquid oxygen and they can be converted into gaseous oxygen. And in the other hand, in oxygen cylinder bank, there is a particular place in a hospital where lots of oxygen cylinders are stored, and these cylinders can provide oxygen. So the oxygen from the liquid oxygen plant as well as the oxygen cylinder bank will be carried to the wards via tubing systems, and which will be used in the ward. So these are very expensive procedures. So having liquid oxygen plant or oxygen cylinder bank is difficult. I mean, when it comes to the maintenance, it's very difficult to maintain this aspect. So very few hospitals throughout our motherland has this facility. So whatever that is, the oxygen which will be carried out from these plants will be utilized in the ward as this manner. So we have a wall oxygen outlet. So in this wall oxygen outlet, we can use oxygen. So just by having the wall oxygen outlet won't be enough. We need certain things called oxygen regulators. So if you can see my cursor, there's a thing with a something like a bottle, and there's a flow meter. So these are called oxygen regulator. Since it is attached to the wall oxygen outlet, these are called wall oxygen regulators. So without these regulators, we can't utilize the oxygen being supplied by this wall oxygen outlet. So this regulator has this part is called the flow meter. So this has, if you can see, some readings. So this is actually, we can manipulate the flow. So this starting from 0 and it goes up to 15. So in this particular flow meter, we can deliver like 15 liters per minute of oxygen to the patient. Whereas if you see the this one, this has something like 30 to like 25 to 30 liters per minute. So that depends on the various flow meters. So apart from this gauging system, here you can see a bottle like thing. This is called the humidifier chamber, and it contains distilled water. So the oxygen which is provided to the patients are vaporized by these devices. So what we are getting from this total device is very vaporized oxygen which will moisten our airways, right? So these are wall oxygen outlet in summary, which are coming from these oxygen plants, like I mentioned previously. So from these plants, oxygen is carried away via a tube system. Obviously you can see some the tube system, part of the tube system here, to the wards, and here we can use oxygen by connecting the wall oxygen regulator, and this end is connected to the patient, right? So this is the ideal scenario, but unfortunately this is not commonly seen in our hospitals. What we seen is the other one, that is the oxygen cylinders. So various oxygens throughout the country, various wards, various hospitals in their wards, they have these oxygen cylinders, and we deliver oxygen to our patients via these oxygen cylinders. And mind you, using oxygen from this cylinder also requires a flow meter, like I mentioned earlier. So this is called the cylinder mounted oxygen regulator. This also we can regulate the oxygen flow, and this contains the humidifier chamber, and this part goes to the patient, like in this picture. So here also we can deliver like 15 to like 30 liters per minute, so that depending on the flow meter, right? So obviously most of our Sri Lankan hospitals, most of our COVID-19 treatment wards, they have this method of delivering oxygen. So they do have a need of oxygen cylinders at the moment, as we consume lot of oxygens per day, as I mentioned at the very outset of my presentation, right? So this is another efficient way of delivering oxygen, and all the past slides I showed you, there's oxygen source either from oxygen liquid oxygen store or a gas oxygen cylinder. So in those plants they have oxygen, then this oxygen will be carried away into the patient. And now this is called oxygen concentrator. So this oxygen concentrator has a special circuit that they can actually absorb the atmospheric air, and out of the atmospheric air there's like 21% of oxygen. So they can effectively extract this oxygen and they can concentrate. So then this machine can deliver oxygen to our patients, and mind you, it's not as high as the previous methods. So I told you in previous slides we can deliver like 15 liters per minute up to 30 liters per minute, but here maximum we can go like 10 liters per minute. But having the scarcity of oxygen, these machines are also very important, as this can save our oxygen in our cylinders and gas in our liquid oxygen stores. So this only requires electrical the current supply. So once you connected this machine into our normal electrical supply, this will effectively concentrate atmospheric oxygen and deliver this oxygen into our patient. So here you can see this is actually a picture I took from internet. Here the oxygen concentration is being used to deliver oxygen to 2 patients, and mind you, we can't provide lot of oxygen, like more than 10 liters, but still having these machines will effectively deliver oxygen to our patient, plus it will save the oxygen from our main oxygen sources, right? So moving into the next slide, this is what I said. Having oxygen won't be enough. We need oxygen regulators and these flow meters for our patients in order to deliver oxygens. And now we have, like here you can see on the right hand side there's a regulator, like single regulator. So here, so this part goes to the wall oxygen outlet, then this part goes to our patient. And you can see by using this machine, this device, we can only cater 1 patient. But in contrast to this machine, if you look into this machine, here from 1 outlet we can deliver oxygen to 2 patients. So this is called twin port oxygen flow meters. These are effectively used in various parts of our, not all of our hospitals has this facility. Most of our hospitals has the single oxygen flow meters, but if you have twin port oxygen flow meters, the amount of patients that we can cater would be doubled. So it is very efficient, especially in a crisis situation like in Sri Lanka, right? So I have mentioned some of these estimated prices in the presentation. Some of you can see, and this is for your convenience. And similarly, like I told you, like in order to use oxygen from oxygen cylinders, we do need oxygen flow meters. Those are called cylinder mounted oxygen regulators. So those are, so I told you, like most of our hospital has these oxygen cylinders, not the wall oxygen outlet. So therefore, in order to deliver oxygens, we need these oxygen cylinder mounted oxygen regulators as well, right? So then we are coming into the major topic, that is the various oxygen devices. I told you having oxygen is not going to be useful, as we need certain oxygen delivery devices. So these are oxygen delivery devices currently we are using, and this is the very simplest out of all the devices. This is called the nasal cannula, and these nasal cannulas are used both in adults as well as in pediatric patients, as you can see in the picture. And these can deliver like oxygen 4 liters per minute, and if you make it into a concentration like as a percentage, this will deliver like 36 liters, like 36 percentage out of 100, and this is not enough for a patient with severe pneumonia, but still we do get patients with little amount of oxygen requirement, so we can use them, as well as when it comes to the recovery of the COVID-19 patients, when their oxygen requirement is getting better, that means oxygen requirement is coming down, we can gradually shift into these kind of devices. And this can be connected to the oxygen concentrator as well. So so the maximum oxygen percentage that we can deliver is 36%, and mind you, if a severe pneumonia patient is there, what we need to give is 100% oxygen. So this is not going to be enough for our critically ill patient. So let's move into the other topic. So this actually a game changer in current COVID-19 battle. It looks very simple device. It just has the standard mask as well as a reservoir bag is attached to the device. But the most important and most interesting fact is we can use this device and we can deliver like almost completely 100% of oxygen, and it can deliver like oxygen like 15 liters per minute, though that contains like 100% oxygen. So particularly these type of masks are very useful in the first contact places where the patients are firstly, when they feel like ill and they feel like difficulty in breathing, they whatever means of transportation, they go to the nearest hospital. So if we can provide these masks to these hospitals, we can save a lot, at least until they reach the required care level. Or if we consider if patient is very critically ill, and if that patient needs admission to a tertiary care hospitals, from the primary care level hospital up to tertiary care hospitals, we need to transfer this patient, and during that process we can use these devices and we can maintain the life of this patient. So this is actually even though like I mentioned like 2500, we can get like, so I couldn't change the values, sorry for that. Here we have like it costs like nearly 1000 rupees now. So if we can provide these masks to each and every primary care level hospitals, we can save a lot of lives. So it's actually a game changer during this COVID-19 battle, because it's a very simple device and it can effectively deliver high amount of oxygen. Right, so moving to the next oxygen device, this is called high flow nasal oxygen device. And if you can remember what I said, all the previous devices I have told you, they can deliver oxygen up to like 25 to 30 liters per minute, but this device is very good device, because it can deliver oxygen up to 60 liters per minute. So it's actually like a double compared to the previous devices. So this also we are using in very frequently, especially in COVID-19 like critically pneumonia patients, we are commonly use this device. So this is a bit expensive compared to a previous non-rebreather mask, therefore we don't have much of these devices, but still this is very effective device against the battle with the COVID-19. And this actually the same device is produced, what we have here is actually it is from New Zealand, and one set of devices are coming from China and Korea, but our Sri Lankan Air Force also had improvised, and they had also produced the similar device like this, and it also functioning in a very efficient manner. like the devices that we have in New Zealand. So the device, the high flow nasal oxygen device from Air Force, Sri Lanka Air Force, is also functioning in very efficiently. It is less expensive compared to the what we have here. So the original high flow nasal devices will cost like 1.4 million. So our Sri Lankan Air Force can give the same device to like 3.5 lakhs. So it's also so in summary, this is a very useful device. So we can deliver a very high flow of oxygen with high percentage. Like we can give almost 95% of oxygen, right? So the next device, these are the tubing system, and we are using for the high flow nasal device. So ideally these should be single use, and I mean we can use this circuit for a single patient and we have to discard them, but unfortunately we don't have much of these circuits, so therefore we have to clean them again and use them again. That I mean that is very problematic, and that is that creates a lot of other problems like creating infections and all sort of problems. But unfortunately we don't have much of these circuits, so we have to use them again and again. So if you going for a high flow nasal oxygen device, we need these circuits as well, right? So now moving into the next machine, this is called CPAP BiPAP machine, or we call it non-invasive ventilators. So this is actually a very good device which in one aspect it can deliver like 30 liters per minute of oxygen, plus we can deliver almost 95 percentage of oxygen. So the flow and the oxygen percentage is like that. Apart from that, it can generate additional pressure support, and this pressure will help our patients to breathe easily. So the in overall picture, the work of breathing would be less when the patient is connected to this kind of a machine. So that is actually a very good thing, and overall they have done various researches, and very recent research actually published on this month. Actually it is from USA, and they have shown using this CPAP machine will reduces the need of ventilation, the need of ventilators and ICU admission. So in a way, these machines are very important, as we can reduce admissions to ICU and we can actually treat patients efficiently. One thing is they can deliver efficient oxygen flow. Another thing is that it can provide additional pressure support, so that the patient will feel less work of breathing. And I mean, if you ask from a patient who had been connected to this kind of machines, at the end of the day, he or she will tell you like, I feel like less difficult in breathing now. This machine really helps me. And so this is actually a very efficient machine currently we are using, but unfortunately we don't have much. So if we have these machines throughout our country, we can do a lot and we can save our patient, right? So if we can save our patient, they will survive. So we can during that time we can buy some time to give other means of treatment, and we can get them cured, right? So moving into the next machine, this is actually the tubing circuit. So if you can see the machine, and machine there's a tubes, and this tube all the way comes here, and this is the mask. So having this machine is not going to be enough. We need the circuit as well as the mask type. So this is the circuit. This is also like I told you during the high flow machine descriptions, these tubes are meant for a single use, but unfortunately we are using them again and again after cleaning them because we don't have much, right? So these are the mask. So there are two types of mask: the vented mask as well as the non-vented mask. So these masks are you can see here this mannequin. It contain the mask which is tightly fixed to the patient, and these masks are coming in very different sizes, basically small, medium and large. So these in Sri Lanka, what we are commonly using is the small and medium size mask. So large size we rarely use, maybe in very big, but in my personal experience we have never used large size mask during this 10 months of period. We always use small and medium size. And this is actually there are two types of masks, like I said you, the vented mask and unvented mask. Both are being used commonly. So if we are getting a CPAP BiPAP machine, we need the circuits and mask as well. That's the summary, right? So this is actually a new machine. I previously told you regarding the CPAP BiPAP machine as well as the high flow machine. So this is called the respiratory insufficiency ventilator. This contains both the function of CPAP and BiPAP. It's something like having two machine in one machine. So if we need high flow oxygen facility, we can switch the machine into high flow setting and we can use them. And if we need BiPAP or CPAP settings, we can switch the machine into that setting. So however, this is also very useful, and it can deliver like almost 100% percentage of oxygen. So it can effectively deliver oxygen to the patient as well, but it's a bit expensive, and we don't have much of these devices at the moment. So all the oxygen devices which I have shown you up to now they can be used in most of the worlds, provided that you have continuous supply of oxygen. And using those devices, we can try to maintain the life of our patients, and thereby we can buy time so that we can use other means of treatment. But having said that, out of the COVID-19 population, patient population, even though you are trying each and every oxygen devices like that I mentioned, still a certain group of patients are getting worse, and ultimately you have to connect them to a ventilator. So if you are planning for a ventilator, if you are planning to connect the patient to ventilator, that patient needs an ICU care. So this is the end results of oxygen therapy. Having failed all these oxygen devices, there is no other means to maintain the life of patient. We have to connect the patient to a ventilator, right? So ventilator, most of these ventilators are seen in ICUs. So having a ventilator won't be enough. You need particular ICU bed, and you need other monitoring devices, and you need other human resources to maintain an ICU. So that's a different story. So maintaining an ICU bed is very costly. So what we should do is we have to reduce ICU admissions. We have to sustain the life of the patient. We have to maintain the life of the patient. We can treat whatever other means, and thereby try as much as possible to reduce the ICU admissions, so that we can keep the ICUs for the necessary patients. So what we are currently do is that if patient comes, and most of the wards, they don't have CPAP, BiPAP or high flow machines, and these machines are available in ICU, say, so in order to give oxygen to these patients, we need to transfer this patient to ICU. So that is not the ideal management. If we have these CPAP or BiPAP machines in our ward settings, we can connect our patients to these machines, and we can look after them at the ward, while we can preserving the ICU beds for a actually needed patients, right? So let's move on to the other one. So this is called the portable ventilator. So one I showed here is fixed. Actually, we can't mobilize these machines, but here this is called portable ventilators. So portable ventilators are used mainly to transfer our patients from our wards to the ICU. So in between, during that process, we have to connect our patients to the ventilator, then only we can transfer our patients. And mind you, some of our hospitals have these portable ventilators. So since we don't have much ICU beds, we have some patients who are being connected to the portable ventilators, and we do care them in our wards just because we don't have ICUs. So unfortunately, we had to we are looking after them in our wards as well, right? So these are the same tubing circuits of these portable ventilators. So we need these circuits as well, and mind you, this is also meant for a single use, but unfortunately we are using them again and again, right? So this is called multi-para monitors. So these critically ill patients actually need monitoring in the sense we are monitoring the vital parameters like pulse rate, respiratory rate, the oxygen saturation percentage, blood pressure, sometimes temperature, likewise. So monitoring these vital parameters is important because these are the ones which tell us the patients who are going into a critical illness. So while continuously observing these parameters, we can early detect set of patients who are going to the critical illness so that we can early identify and we can treat them and we can prevent them actually going into critical illness. And at the same time, these devices are important to see the response of the treatment. So if we can identify a particular problem and if we can treat them, so then we can see the response of the treatment while observing his vital parameters. They are actually getting better if the treatment is working. Right. So island-wide, we do have a major requirement of multi-para monitors. We have critical ill patients, but unfortunately, we don't have much monitors throughout our country. So this is also very important thing when it comes to patient management of COVID-19. And this is called pulse oximeter. So if we can't get these type of multi-para monitors, at least if we can get these type of pulse oximeter, that would be efficiently used for the care delivery of COVID-19 patients. So this shows just the oxygen saturation of the oxygen content in the blood as a percentage. So if we can see them, if we can monitor them, we can early detect patients who are going into critical illness and we can treat them. So and the other problem is that the COVID-19 is known to cause happy hypoxia. So if I describe the term happy hypoxia, mean some of these COVID-19 patients, they don't complain of having difficulty in breathing. They just happily walk and they do their own work, and they don't have any problem. But if you actually measure the oxygen saturation percentage, that is very much low. So this is kind of an interesting but very dangerous situation that we are facing. So most of our patients, they are coming and they don't have the symptoms, but their oxygen content is low. So if they don't come, we can't detect them. So unfortunately, some of these patients will actually they have lost their life during homestay just because they don't have symptoms. So they are reluctant to come to the hospital. But they have the disease, they have low oxygen content, and it's getting worse day by day. Then ultimately, they will end up with irreversible state where we can't save them. Right. So this device is important in that manner because we can detect these silent hypoxic patients using this device. Right. So these are called syringe pump and infusion pump. So these critically ill patients need certain drugs which should be delivered in very specified manner, and we should not exceed, and on the other hand we should not reduce the amount of drugs that should be delivered. I can give you some examples. So some of these COVID-19 patients, they go into a condition called septic shock where their blood pressure will drastically drop, and in order to maintain their blood pressure, we should give them some drugs. Those are called vasopressors or inotropes. So giving these inotropes is not going to be like connecting them to a bottle of saline and connecting them to a cannula. It's not going to be like that. We need to give a specific amount of inotropes during a specific amount of time. That is only can be done using this infusion pump or a syringe pump. So if you can see the infusion pump picture, I have shown a picture shows 80. So this means this machine at this movement delivers like 80 ml per hour, right? So that is very correct and very efficiently it delivers. So it's also important in delivering especially critically ill COVID-19 patients. So most of our patients are critically ill, and these patients actually do need them, and this syringe pump and infusion pump also we have a very big requirement, and which should be we should provide them as soon as possible. So this is called suction apparator. So these patients are getting a lot of secretions like phlegm and all sort of things. So we have to use them to clear out secretions, otherwise they will collect and they will clog and can cause various problems. This is used in the treatment as well as rehabilitation in both parts, so this is important, right? So this is portable ultrasound machine. I told you these our patients are critically ill, they may need invasive procedures, and if you do these invasive procedures blindly, they can have a lot of complications. So using ultrasound machines, we can actually do the invasive procedure under ultrasound guidance, which can precisely we can do that procedure, and at the same time we can prevent complications and other problems. So these are mainly used in COVID ICUs. So all of these hi-fi gadgets that I am shown here have some problem, because some of our hospitals may have these kind of machines, but only problem is that in current situations we are not only getting COVID-19 patients, we are getting patients who are having other ailments as well. So we have to maintain COVID ICU, plus we have to maintain and separate ICU for other ailments. So the same machines which are using for these patients and for non-COVID patients cannot be used for COVID-19 patients, because that can cause cross infection. So that's the problem that we are facing. Some of our tertiary care hospitals also sometimes may have these devices but cannot be utilized for both patient population. So we need actually a separate machine, right? So the next thing is that CTG machine and Doppler fetal heart sound detector. So we do have a lot of pregnant mothers coming with COVID-19 infections, and they are delivering their babies, and we have to looking after their mother as well as the babies. So these machines are used mainly for the assessing the well-being of fetuses. These machines also have the same problem, where we can't use the same machine for a non-COVID patient as well as COVID patient. So we need a separate machine, right? So these ECG machines. So COVID-19 is known to cause a lot of cardiac complications like heart attack. We call it myocardial infarction, and they can cause myocarditis, various irregular beating of your heart. They are called arrhythmia. So all of these conditions can be diagnosed using this ECG machine. So the same problem. Most of our hospital they have one ECG machine per hospital. So the ECG machine that we have cannot be utilized for non-COVID patients, because they can cause cross-infection, right? So this is called 3-function hospital beds. This has 3 function actually. One function is we can elevate the head end, other one is we can elevate the foot end, and the last function is we can elevate the total bed up and down. So these beds are important, especially in COVID-19 patients, as these patients are having difficulty in breathing, and we have to keep them in head up position. So we have to elevate their head and we have to keep them in the reclined fashion. Then only their difficulty in breathing settles, and the oxygen content in the blood also markedly improved with that positioning. So positioning is important in COVID-19 patients. So to position them, we need these kind of beds. So we have seen so their outcome is far better when they are being cared in this kind of beds. So you have to need not to tell you that we have very big requirement in these hospital beds as well. You have seen in various videos which had circulated in social media, right? So I have discussed major parts of oxygen devices and other requirements. So this is the whole story that we did, and we are currently facing. So unfortunately, day by day we are seeing a lot of patients who are suffering, and ultimately they lost their life. So it's very really pathetic, and they may be having various other issues like family members, and sometimes they must be very rich, but the COVID-19, they doesn't care about any of the facts. It's actually simply COVID-19 doesn't care any of these facts, right? So hopefully thanks to our government, and we are having the very efficient and very quick, very efficient as well as very successful COVID-19 vaccination programs. And I think Sri Lanka is currently at the number one position in according to the world rankings when it comes to vaccinations. But still, this might take several months for the fully activity, and most of our patients have only got only the first dose. So the current Delta variant is not immune against first dose. We need double dose vaccination. So still we have our problems, and still we have to survive by our own until this vaccination come into effect. So so until that time we need to be prepared, and we need to look after our patients, and we need to maintain the life of our patients. So thank you very much, and hopefully I see that we can get the help from most of our own people, and this is our own mother, this is our own fathers, this is our own sisters and brothers, and ultimately this is our own people who are suffering and people who are dying. So let's help them to get back into their lives. So thank you very much.